Hello Jokers, thanks for watching this episode of Jokers Physiotherapy. Today I'd like to share with you 6 TMJ disorder exercises by Mariano Rocabado. He was a trained dentist and a physiotherapist from Brazil, from my memory, who has done a great work over the years in providing a very useful and effective exercise series for TMJ problem, as I said. So let's get started. So there are 6 of them. First one is to find a comfortable and resting position for your tongue and your mandible, the lower jaw. So you put the tip of your tongue on the roof of your mouth just before the front teeth coming down. There's this rough surface on the hard palate called the alveolar ridges. And then relax your jaw, therefore your teeth are apart. Keeping it there for 6 seconds. And you repeat that 6 times in one session, 6 times a day. So in most people, if you're doing it at the desk, every hour or 2, you'll be doing this. The main thing is with these exercise series or any exercises for your rehab, the main thing is you keep repeating. The effect of doing it once it may be minimal, but when you start to repeat it, the body starts to get used to it. It'll normalize its function, and that's what we want to do in rehabilitation, to put it back to its full spec. Okay, second one is in the tongue at the same position at the roof of your mouth, and open, called a controlled opening. I call it Oxford stretch because it was often encouraged at the Oxford Hospital in the UK. So I tell my patients it's an Oxford stretch. Often people remember it easier that way. Okay, so I've done that 3, but you continue on for 6 lots consecutively in Rocabado's program. I tell my patients when it's Oxford stretch, it's done for 5 seconds for continuous 60 seconds. So that's like 10 to 12 repetition in 1 minute, and repeat that 6 times a day. But either way, the main thing is you're repeating the same exercise. Now the third one is stabilisation of the TMJ. So it's resisting exercises. So you place your index, middle finger on the front part of the chin, and the thumbs placed underneath the chin. And first of all, the thumb resists your jaw opening. So your jaw's doing that, and then the thumb's resisting. Six seconds. And when you do this, you need to have your good posture. Ideally, no hump. All of the exercises. 3, 4, 5, 6. You can do, and then you can do closing from a relaxed state with your teeth disengaged. You try and close back up, and these fingers resist. So net effect, the jaw doesn't move. Okay, so repeat that 6 times. Of 6 seconds each, and 6 sessions a day. Okay, so the fourth one because Rocabado believed there is a very strong link with the head and neck posture to the jaw problem, which I believe is the case also, because they both share trigeminal cervical nucleus as the area of convergence from the neck and the jaw. All the pain information goes into a nucleus in actually C1, 2, 3, and therefore they're all important. Anyway, so here the second part of the program, so 4th, 5th, 6th exercises involve neck and shoulders. So with this one, you interlace your fingers, put it behind your head. Now I put it behind the head. I think Rocabado recommends putting in the neck. You can do that too. But the main thing is you actually tuck your chin back and then chin in. If you just do a chin in, that's just same as looking down, and it's actually going to make your posture worse. So first of all, you actually need to push the back of the neck, back of the head into the hands, palm, back. So you're doing it from the sideways. Hand is kind of pushing it forward, and you push it back with your neck. Okay, push it back and then chin in. But you're not going down like that. Just push back and try to chin in. A little nod, not big nod, because you don't want to look down. 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. So you will continue on for 6 reps, 6 seconds each hold, and 6 times, 6 sessions per day. Okay, moving on to the 5th one. Cervical retraction is a simple pull back. I'm not pushing, it's a reference point. So you keep looking forward and then at your eye level and then pull back. Now when you do this, you don't want to do that, you don't want to do that. You want to just purely go back. So eye height, looking forward. And when you do this, you want to make sure prior to pulling your chin back, shoulder blades ideally should stay back. That makes it easier. And as a result, if you touch the base of your neck, the hump disappears. Again, I'm just adding my flavor to the Rocabado's exercise, so sorry about that. Mariano, Rocabado doesn't explain maybe that way, with respect. Yes, so just chin back. Okay, and the 6th one is to pull your shoulders back. Hold it, 4, 5, 6, and slowly let go. And again, 1, 2, 3, 4, 5, 6, and let go. And 1, 2, 3, 4, 5, 6. And while you're there, you want to pull back your head, shoulder blades back, squeeze and chin back. So you're adding the 6th one. In addition, you add the 5th one, which is pulling your head back. 5, 6. 1. I like doing this, so I'm just continuing to do it. The proper 6 reps. 5, 6. 1, 2, 3, 4, 5, 6. How many did I do? 1, 2, 3, 4, 5, 6. And 1, 2, 3, 4, 5, 6. I think I've done the 6 reps. So, these Rocabado's 6 exercises for TMJ disorders have been around for a long time, and it's been validated many times. But as late as 2015, February, it was again researched. I think this research came out of India, and it was from researchers Mulla, Babu, Kumar, and Rizvi. They have done effectiveness of Rocabado's technique for subjects with temporomandibular joint dysfunction, a single-blind study in the International Journal of Physiotherapy, Volume 2, page 365 to 375, February 2015. So they have they have actually gone through and did the research. They have found that these series of exercises are effective. Now, in this study, they've got them doing 6 reps of 6 seconds, 6 sessions per day for 6 days per week for 2 weeks. So after 2 weeks, they found a significant difference in the TMJ disorder, pain, range, things like that. So that's a great start. I think 2 weeks is not long enough for it to have a sticking permanent change to the symptom. It just doesn't make sense physiologically that will stay that way. But it's a start that, you know, even doing so in 2 weeks, 6 days, so that's 12 sessions or 12 days of doing 6 reps, 6-second holds, 6 sessions can make huge difference. Considering you're using your jaw up to 2,000 bites per meal, 3 meals, or 6,000 bites per day, with other usage of talking and things like that. So you actually using your jaw and associated joints and the supportive joints, which is the neck and head, and the neck and head and shoulder muscles, for that sort of amount. And you don't walk that many steps or hours on a daily basis, so it's understandable that jaw can have issues, and that requires a lot of training to bring it back up to speed and rehabilitate back to the full specification. Anyway, thanks for watching today's episode. It's been a pleasure, going through and researching, and I'm certainly going to use some of these exercises in the patients I see, and I'm sure we're going to have a great result from this. So, thanks for watching. See you next episode in another episode of Joker's Physiotherapy. Cheers!